Hi, so I'm Dr. Erez. Nice to connect with you. And I just wanted to tell you guys kind of a little bit more about my own practice and some of the advanced testing that I do with patients. So, yeah, I'll just do a quick rundown of some of these really interesting tests that can give us clues as to what's going on with, various chronic health issues and even just kind of optimize our health as well. So the first one I often do with patients who are presenting with gut issues or various complaints, autoimmune conditions, things like this. I'll do what's called a comprehensive stool test, and I use various companies, but one of the ones that I use is called Genova Diagnostics GIFX. And I'll just kind of show you a sample report and kind of walk through some of the just give you an idea of what that would entail. So, we give a stool sample over 3 days usually, if we're looking for parasites, let's say, or something like that. And we get this overall picture of our body's gut functioning. It gives us a measure of how we're digesting things, how inflamed our gut is, how much of an imbalance of bacteria there is in our gut. It's just kind of like the metabolic milieu of the gut. So it gives us a sense for, what our gut microbiome is actually producing when we give it food. It also gives us an overall score for infection. So this might be parasites, it might be a specific pathogenic bacteria, et cetera, et cetera. So this is just an overall score, but we get really detailed, granular information about things like our pancreatic output here, or how we're digesting fats, our inflammation levels through these various markers like calprotectin and eosinophil protein X. We get a sense for how much butyrate is being produced by the microbiome, which is very healing for the gut lining. We might get a sense for is there a big imbalance in the types and species of bacteria? And that oftentimes will clue us into specific imbalances that we can treat with supplements, vitamins, sometimes prescriptions, but oftentimes we can do it with just supplements or change in diet or eating specific foods. For example, here you see Akkermansia muciniphila. This is a really important gut bacteria that produces the mucin lining of our gut and is very important for avoiding gut permeability issues. And so we can do things about this to really increase that. It also gives us a culture result, which is great. It looks at yeast. It looks at all of these parasites. So we might, and I do see parasites in some of my patients, and for example, blastocystis or Dientamoeba fragilis, those are sometimes found. It gives us culture results. And in particular, it tells us which, antifungals or natural antibiotics might be more or less likely to help with the particular imbalance of bacteria. So overall, it's a really useful test and one that I frequently do use with patients. So another one that I often do is hormone testing. And I use something called the Dutch Plus, or if we're looking at, we want to know about the whole cycle or the whole menstrual cycle in a female, we might use the Dutch Cycle Map Plus. So same thing, let's take a look at kind of a sample report. And just to show you some of the detail here, we get a sense for all of their sex hormones and a lot of adrenal hormones as well. So if somebody is dealing with fatigue or chronic fatigue or dealing with a lot of stress or let's say insomnia, these are all things that we would want to know about to see if we could figure out what an underlying cause of their symptoms was. And so here's a sample report of the Dutch Plus. It gives us a sense for where this patient is in terms of their estrogen, their progesterone, their testosterone. And so especially progesterone might play a big role in people having sleep issues as they get closer to perimenopause or menopause. Testosterone, obviously, a huge impact on muscle growth, lean muscle mass, also libido. We get a sense for their cortisol or stress hormone production. So in this particular case, it looks like they have very low morning levels and kind of high daytime output, which could tell us that this patient is overproducing cortisol and is very stressed during the day. Sometimes we see a spike at night, and that can stop people from going to bed. And we use supplements and various treatments to try to improve that. And so it's a very, very useful test. We also get breakdown products of estrogen. And so this is a very important thing for women to know if they're overproducing certain types of estrogen that might be damaging or might put them at risk for certain diseases, especially breast cancer. So if we give somebody estrogen, this is definitely something I like to get, is to see where their estrogen is going. And we can, let's say they're overproducing a dangerous form of estrogen, we give them something to try to reduce that, oftentimes natural supplements. So this is overall a very, very helpful test. It's one that I often use with patients who are dealing with hormonal issues of various kinds, or also one that I use frequently with people who are dealing with trouble losing weight. We can get a lot of insights into why they might be having trouble losing weight through that particular test. Another test that I oftentimes will use in patients is advanced cardiovascular and metabolic testing. This looks at things like cholesterol and is way more advanced than what you would get, let's say, at your primary care doctor's office, just looking at LDL cholesterol, HDL cholesterol, total cholesterol, and triglycerides. So I use a company oftentimes called Boston Heart, and they have a whole panel of things we can pick depending on the patient's risk. And we can assess their cardiovascular risk in a way that we can decide how aggressive to be in their treatments, both dietary, supplement, and medication wise. So they have these tests that you normally wouldn't get, by your primary doctor's office. So for example, we would get LDL particle number. This is a much more accurate way to look at LDL cholesterol. We get something called ApoB, which is another marker that helps us assess cardiovascular risk. We get all these inflammatory markers, so hsCRP, LPLA2, myeloperoxidase, fibrinogen. This tells us how much inflammation is going on in the blood vessels. We also get some metabolic markers. So what's their sugar like? What's their 3-month hemoglobin A1C like? What is their adiponectin, which is a very important signaling related to weight loss and weight gain? What's their insulin like? Are they overproducing insulin? That would make them more likely to be metabolically unhealthy or gain weight. So these are all a very, very useful markers that we can use in patients. Another test that I may ask patients to get, depending on what they're looking for, is epigenetic testing or genetic testing. I don't just use what we call SNP testing, which just looks at a very small amount of the DNA. Oftentimes, I'll ask patients to do whole genome sequencing. And this gives us a way broader database of their genetics, and we can really look in detail at specific genetic tendencies that might be underlying some of their chronic conditions. For example, oftentimes I will look at somebody's histamine-related SNPs or histamine-related genetic polymorphisms. So these are genetic polymorphisms that might make somebody have a harder time digesting or metabolizing their histamine in their food. Oftentimes this leads to gut issues, bloating, reactions to food, trouble eating a normal diet. So this can be a really useful test for that. We might look at, things like their methylation pathway, MTHFR, which is can be related to people's utilization of folate and what type of nutrients we give them. So there's this whole field of nutrigenomics, which kind of looks at how does the food that we eat affect our genes and vice versa. So that's another great way to get information about how we're functioning and oftentimes get to some of the conditions that I treat. Another test that I may do with patients is called 16S RNA microbiome testing. So this is a very, very detailed look at the gut microbiome. So if we don't get enough information with a normal gut test, we might look at this detailed gut microbiome test that gives us additional information. So I'll just kind of show you what that might look like. As you can see, there is tons of data here, and this is basically looking at hundreds of classes of bacteria in our gut, and we really get a sense for if there's imbalances that might be leading to their symptoms, whether it be an IBS patient or, a patient with SIBO, or maybe a patient that has an autoimmune condition. There are certain imbalances in specific species and classes of bacteria that can be pushing them towards that autoimmune condition. And also helps us decide, what probiotics to give them, what prebiotics to give them, what should their diet look like to try to push them towards a more healthy balance of bacteria. Another test that I do oftentimes with patients is toxin testing. And we're exposed to toxins every day of our life. And it's definitely something that impacts us on a regular basis. So especially in some of these patients who are dealing with this just chronic fatigue, and they've looked at, done multiple tests that have come back without any results pointing to a cause, we might do toxin testing to kind of look and see what they're being exposed to and see if that might be a trigger for their illness. So for example, this is one of the toxin tests that I tend to do. Are they being exposed to glyphosate through their food? Are they being exposed to a ton of parabens in the health and beauty products that they put on their skin or on their face? Are they being exposed to phthalates or plastics that are impacting them? Are they being exposed to triclosan, which is a antimicrobial that's put in a lot of soaps and hand washes and things like that? So this is a very detailed look at all of the toxins that they might be getting exposed to on a day-to-day basis. And there are things that we can do to improve their excretion. We give them certain nutrients that help with, excreting the particular toxins that they're being exposed to. So another test that I oftentimes will use is heavy metal testing. Again, let's say patients are having neurological complaints or chronic fatigue or autoimmune conditions. There's just so many negative consequences to heavy metals in our body. And sometimes we don't really know that we're being exposed to these. For example, you might be being exposed to cadmium in your protein supplements or your nutrition shakes, things like that. Or you might be exposed to lead in your chocolate if you're a big chocolate lover. So heavy metal testing, here's an example of heavy metal test that I do with patients. It's a tri test, meaning of mercury. So it looks at mercury and not just at the blood, but also in the hair and the urine. So it's a very detailed breakdown of the mercury that we're being exposed to. It also looks at things like cadmium, like I said, lead, antimony, arsenic. All of these things can really impact our health. And if we don't test them, then oftentimes we don't know what we're being exposed to. So just wanted to tell you a little bit about some of the tools that I use. And hopefully that tells you a little bit about my practice. If you're interested in working with me, reach out by email. My email address is draaronerez@gmail.com. Looking forward to working with you, hearing from you. If you have any questions at all, don't hesitate to reach out.